Hi, my name's Deanna Setterby. I'm a professor here at Cypress College, BA, MSN, RN, CHEP. I'm going to teach you how to do a simple peripheral IV start. The first thing I do when I start an IV is I gather all of my supplies. When I start an IV, I remember that it's important to have all my supplies with me, prepped and ready to go. When you do a peripheral IV, it's a simple, clean procedure, but it is important to have everything with you and ready to go because you're not going to have any time to go and grab anything with you. You're usually alone, and you got to have all your supplies ready to go so that your patient's not bleeding and that you don't have any infections occurring at the time. So a typical IV is going to need a 10 cc IV flush. You're usually going to need a pen so that you can put your initials on your tegaderm. So that means you're going to need a tegaderm. You're going to need some simple tape as well for chevron dressing. You're going to need to select a size for your IV insertion, for your IV catheter. We have a hand model here, so they only take 22 gauge. That's usually a pediatric size or small vein size. In order to do blood insertion, you're usually going to want to go for a bigger size. So remember that with IV tubing, you go down on the number, so it's opposites. So if you have a high number, like a 24 gauge, that's something that you would use on an infant. So 24 gauge is an infant, a 22 is a pediatric, a 20 gauge is pretty small, and if you want to do blood, you're going to go for like an 18 or a 16 gauge, but not all veins are big enough. So what you do in an emergency room environment, for example, is you're going to hydrate a patient, plump up those veins. So you'll go in with like a 22, plump up your veins, and then you'll find another IV insertion site and go for a smaller number, but a larger diameter gauge, and you're gonna get that blood IV gauge, okay? And because this is peripheral, clean kind of insertion, you are okay to use alcohol wipes. And I use a couple just in case I wanna do another site, and I do my IV kind of hunt. Alcohol wipes are fine. Sometimes, depending on if there's a little bit of bleeding at the site, I do have a couple of 2x2s available for me. I like to have a tourniquet as well. I have my extension with me as well, my extension tubing, and I have some clean gloves. Now, when I start my procedure, I like to hunt for my vein. It's very important when you hunt for your vein that you're going to tie tightly. But before I start any of this, I'm gonna do my hand hygiene. Now, I need clean hands, but not gloves right away. So I'm gonna go ahead and wash those hands and make sure that I remove any type of hitchhiking pathogens. So I'm going to rub my hands until they are completely dry. So we remember when we talked about this when we had COVID, the alcohol must be absorbed off, but we also need friction. So we rub until the opportunistic pathogens, hitchhiking pathogens have left us. Okay, here we go. My favorite part. So you want to go above your insertion site. So you tie tightly. I like to pull one side very tightly so that my veins will come to the surface. If the veins do not come to the surface, you have not pulled tightly enough. Remember, if you have an obese patient, you probably need to pull tightly. Tell your patient, you may experience a little bit of tightness or a little bit of a pinch. You always have to communicate with your patient so that they know this may be uncomfortable. We never do something uncomfortable or invasive without telling our patients. So as I've pulled tightly, I see, oh, now a vein has come to the surface. I hunt for my veins. I never want to insert a vein or an IV where there is a bifurcation, okay? This is not a good place to do an IV insertion. I need about an inch worth of space. So if I were to go here, the catheter would go through. That's not a good site. If I go here, it's not enough space, right? I would get stuck at the bifurcation. If I want to go, say for example with an IV, I could enter right before the bifurcation and I would be okay. I can enter in between the branches here and I would be all right if that was a site that I wanted to select. I don't want to go to a vein that's too narrow in diameter because I would also lose the bifurcation site. So it's okay to kind of walk around your patient. You can enter this way as well. Now remember, this is just a hand model, so it's not the same as people, but you also want to kind of maneuver with your own fingers before you're gloved because you can feel sometimes veins roll, sometimes veins sink, and you want to kind of manipulate and see what your patient's veins are like. Of course, without cutting off the circulation for too long. I'm not going to narrate like this when I'm with a real patient. I found the vein that I like, so I'm going to go ahead and start getting my supplies ready. I like to label my label ahead of time, so I'm going to put today's date, which is 11/9/22 DS. And today we're going to say it's 3:15 p.m. Okay, so we have that ready to go. I'm going to open up my catheter even because it's still clean area. It's not open yet. Make everything as easy as humanly possible for yourself. I'm even going to get my tape ready because with gloves, things get a little bit clumsy sometimes. So you just want to make things easy to tape. Okay, I like to separate it, make it easy for myself. Okay.
Are you going to put this flush to the extension site now or after?
I'm going to put it to the extension site even before I glove. Okay, I got everything ready to go for myself. Just make my life easy. I just open it. I'm not putting it on till my gloves are on, but I get it close. Now in real life, I would have taken my tourniquet off and put it back on for the patient, right? Because I'm doing a demo, I'm leaving it on, okay? It would have gone off. You're not gonna go set it up. I would have set it up, talked to you all, put it on, done my thing. Does that make sense? All right? So we would have had it set up
and then you
and then gone in, right? Set everything up, hunted, went in.
Okay.
We would not have done it the other way around because we don't need to.
Okay.
The setup would have already been happening. Okay. We don't even need to remove it. Okay.
Okay. All right.
All right. So now we have our alcohol. We already hunted for our vein.
You already flushed the line, so you're not injecting air. Okay.
Exactly.
All right.
So. Okay. Now we remove, and it's all about the angle. I make sure my bevel is up. Okay. I go in, I make sure the light is correct. Go into my angle. And I see a flash of blood in my imagination. I slightly advance more with my needle, and then I advance more with my catheter. I immediately remove my catheter, and I hold here so that the patient isn't bleeding all over the place. I make sure that I get rid of my sharp. Okay. I have my connection. Okay, and because it's sterile, I connect quickly. And I flush. All right. And then I place my tegaderm. Okay, now that I know that that's not going to get out of place, I can start to have a little bit of control with my taping, okay? Panic is over. This is the part that I can breathe a little bit better. Sometimes, you know, this is the part where people lose IVs, but I know that I'm covered enough. Okay.